Today, I'm going to discuss the kinds of questions that will arise during a consultation for cosmetic eyelid surgery. Specifically, I'm going to go over the upper eyelid, the lower eyelid, and the surrounding tissues that need to be evaluated prior to undergoing a procedure so that you end up with a great result. So when you choose the type of surgeon you should go to, I would recommend a facial plastic surgeon, oculoplastic surgeon, or a plastic surgeon that just focuses specifically on the face, because there's a lot of subtleties to evaluating the face, and also there's certain techniques that are very specific to the eyelids, which some plastic surgeons don't have a facility or familiarity with doing the procedure. So I personally have been performing these procedures for over 35 years, and I have a lot of expertise in terms of evaluating as well as performing these procedures. And that's why I can give you insight into this subject. Now, eyelids cannot be evaluated in a vacuum. They have to be looked at as a continuum in the face. What does that mean? That means that the upper eyelid, for instance, is a continuum of the eyebrow and the forehead, and the lower eyelid is a continuum of the cheek and midface. So you have to look at all these components, because each one of those components can have an impact on the evaluation of the eyelid surgery itself. As I discussed in my previous videos on brow lifting, the forehead laxity or ptosis, droop of the upper eyebrows and forehead, can impact the upper eyelid redundant skin. So we have to know we have to evaluate where that position of that brow is relative to where the eyelid tissues are. Now, sometimes there's loss of volume of the eyebrow itself. Sometimes there is furrowing of the forehead and laxity, or sometimes there's actually a weakness of the brow itself due to a facial nerve injury or a facial nerve impairment. So all these things have to be evaluated in terms of the upper lid. Now, the upper eyelid itself may have some hollowing in the deep and creating a deep sulcus of the upper eyelid. There may be bulging of fat. There may be laxity of skin. All those things, of course, are relative to the are relevant to the eyelid itself, but the adjacent structures all have an impact on the upper eyelid itself. So we need to keep that in focus and keep that in mind when we're evaluating the upper lid. Sometimes there's ptosis, maybe there's drooping of the upper eyelid due to an underlying weakness of the muscle. That all has to be evaluated prior to coming up with a plan in terms of surgical plan, and if it's missed, you're going to end up with a result that you're not going to be pleased with. So the evaluation is key. Before any surgery is undertaken, the evaluation is more important than the surgery itself. The lower eyelid itself also has to be evaluated, not in a vacuum as a singular issue, but as a part of the lower face or the mid-face area. Sometimes the bulging of fat here can be accentuated by a flattening of the mid-face, and sometimes there's a deep groove over here which creates a very tired, fatigued appearance. There may be a loss of volume in these cases, or there may be laxity of the attachment of the lower lid to the corner of the outer corner of the eye. All these things need to be evaluated and checked off before the surgical plan is undertaken, so that you will end up with a better and ultimately a happier result. During the consultation, communication is key. You have to be able to express what your issues are, what your goals are, and the surgeon must be able to evaluate that and digest what you're trying to achieve, and also assess what your tolerance is in terms of surgery, in terms of risk tolerance, and also, of course, what your financial limitations are as well. All those things have to be taken into account in terms of planning the procedure. This is elective surgery. there can't be any salesmanship or pitch in terms of what you should have done. It is really a discussion, a free-flowing discussion with no limitations between the patient and the doctor. In other words, you have to feel comfortable ultimately with your decision. It's your decision about what you want, how it's done, what kind of anesthesia to choose, and so forth, based upon the type of procedures you're going to have and also any other limitations you may have. Now, you may also have some medical limitations. So some patients have other issues that limit our ability to do all the procedures that they may consider. Okay, they may be medically not as stable to undergo a prolonged procedure. Therefore, you have to limit your horizons and limit your goals in terms of what we want to achieve. Another important aspect of the consultation is to evaluate the motivation of the patient. Okay, what is your motivation? Did you recently have a divorce? Was there any life crisis that occurred? Is there any other issues that are edging or pushing you towards surgery? Those things have to be evaluated too, because surgery is not going to solve social issues. It's going to only solve physical issues. So therefore, we have to make sure we're on the same page in terms of what is motivating you to actually go forward with surgery. Otherwise, you're going to end up with a result that may not satisfy you in the end. You also have to consider how much time you have to commit to the surgery and the recovery of the following the surgery. So if you're thinking that, well, I'm going to be on vacation in 2 weeks and I'm going away to Bali and I want the surgery done right away, I would say that's not a good decision, because obviously if you need to be seen postoperatively, it's not great to be a distance away where the doctor can't evaluate you properly. So you have to allot enough time to recover and also not put yourself in a pressurized situation where you feel like you have to make a decision right away and you have to have surgery and you have to have recovery and everything has to go in an accelerated manner. Sometimes people take time to heal, and therefore you must take enough time and allot enough time to go through the recovery process. Now, eyelid surgery in and of itself is somewhat predictable in terms of the recovery. I usually remove sutures within 5 to 7 days following the procedure. However, if you're going to have additional procedures done, like fat grafting, laser resurfacing, other brow lifting, you have to allot enough extra time to heal in those circumstances. So everything you add on to the procedure that may be necessary to achieve your goal may take more time to recover. So you need to allot enough time for that to happen. And I don't want any patient to come in who feels like there's a specific time allotment that has to be abided by, because your body will take its time and not everybody heals at the same rate and so forth. So I would really encourage you not to do this before any major events. So if there's a major wedding coming up, or if there's a communion or bar mitzvah or whatever it is, you have to allot enough time to recover in a very relaxed manner and not feel like you have to get somewhere fast, because otherwise you're going to be stressed out and it's not going to be a good situation. Because I can't do anything more than help you, recover as quickly as possible, but I can't accelerate things if your body is taking its time healing. No question is going to be embarrassing or ridiculous to present to the surgeon. You can ask any questions. Every question is okay, because you're not an expert in eyelid surgery and you're not an expert in facial surgery. So anything you bring and ask is okay. So don't hesitate. Come with your questions, and hopefully the surgeon is going to answer those questions to the best of their ability. Now, in terms of other preparation prior to surgery, you need a medical evaluation by your internist, and you need an EKG, blood work, and any other evaluations that they feel are necessary to have a safe procedure performed. This is especially true if you're having intravenous sedation or general anesthesia. All of my cases are either done under local anesthesia or under IV sedation, but some surgeons choose to have general anesthesia as well. The bottom line is that your procedure has to be evaluated as an individual. Everybody has different nuances and different problems that are associated with the eyelids itself. So you have to go to a surgeon who has the sophistication to be able to evaluate your eyelids in relation to the rest of your face. And then you'll end up with a great result that you're going to be pleased with. I hope you found this video to be informative. If you have any further questions regarding cosmetic eyelid surgery, please leave them below. Please subscribe to my channel, and I look forward to seeing you in my next video.